Good afternoon. I am Mariano, consultant at GCRM, and today I will be discussing 10 lifestyle choices that impact your IVF chances. However, before we go into these lifestyle factors, I need to mention a few vital points. None of these factors, and therefore none of these interventions, makes a dramatic difference to IVF success. None, that is, apart from smoking. Therefore, it is vital to keep what I will be discussing in perspective. However, these choices do provide small incremental benefits, and the purpose of the next few minutes are to empower you by giving you the science behind different tools you can use in your lifestyle to improve your chances of IVF. And at the same time, I hope this would improve your overall health, which I then hope will improve your life satisfaction overall. These points are definitely not intended to make you beat yourself about what you did or didn't do. That is certainly most counterproductive. If there is one thing I would like you to take away from today, is that you need to be kind to yourselves. In the next few slides, you will come across some points in bold. These are official UK guidelines from either the National Institute of Clinical Excellence, the Chief Medical Officer, or from professional bodies such as the Royal College of Obstetricians and Gynaecologists. The first lifestyle choice I'll be focusing on is diet. And before we discuss diet, we need to know what guidelines recommend your target weight should be before IVF. National guidelines recommend that women having IVF should aim for a body mass index between 19 and 30. Now, body mass index is not a perfect marker. In fact, there is no absolutely perfect marker for determining obesity. However, body mass index is the most widely used marker as it is standardized, used internationally, and there is therefore a great wealth of studies exploring different aspects of health using BMI as a cutoff. Therefore, it is here to stay, and we should try and make sense of how much BMI affects the IVF chances using the science available. Normal BMI is classed as being between 19 and 25. If the female partner's BMI is between 25 and 30, the odds of a live birth with IVF is reduced by around a tenth. And if her BMI is over 30, the odds are reduced by a fifth when compared with women who have a normal BMI. Now, there are not as many studies for men, particularly in the BMI range between 25 to 30. The studies which there are indicate that the odds of IVF being successful are reduced for men who have a BMI of over 30, but by how much remains uncertain. The impact persists after adjusting for the female partner's BMI. Now that we have got BMI out of the way, let's look at which diet is best for IVF. A balanced diet with good amounts of fruits and vegetables is advisable, but there is no clear evidence that a particular diet is better than others for IVF. Now, next question is, which diet is best for weight loss? Is it keto diet, paleo diet, Mediterranean diet, intermittent fasting? Despite what you might hear in popular media, head-to-head studies have not shown that any one diet is better over the others for promoting weight loss in the medium and long term. The second lifestyle choice we will be discussing is exercise. There is no evidence that performing exercise is harmful to your IVF chances. And a sedentary lifestyle, in fact, increases risks such as blood clots in the legs during IVF and during pregnancy. Now, there is in fact evidence that physical activity before IVF improves your chances of a live birth, and physical activity during IVF pregnancies reduces risk of high blood pressure and diabetes. Now, what sort of exercise should be performed? To answer this question, I would guide you to the Chief Medical Officer guidelines on exercise during pregnancy. Up to 150 minutes of moderate intensity exercise should be the aim during pregnancy. Now, it is important to listen to your body and adapt. If you're not accustomed to this volume of exercise, otherwise, start gradually and step up. Now, next question is, what about men? There's not much data, but given that exercise is good for health, it would seem intuitive that it is good for sperm health too. Some studies suggest to avoid tight shorts during cycling, but I have to say that this has not been conclusively proven till date. Now comes smoking. Now, this is a lifestyle choice there is plenty of evidence for, and the national guidelines therefore firmly advise that men and women having any fertility treatment should stop smoking, and with good reason. Women who smoke have half the chances of IVF as those who do not, and those who say men might only take the odd puff, being a social smoker, etc., there is good evidence that even passive smoking, that is inhaling secondhand smoke from a person smoking next to you, reduces IVF chances by a fifth. For men, smoking reduces chances of IVF by more than a third. The fourth lifestyle choice we discuss is about alcohol. Now, here, the national guidelines do state that men and women who have IVF should be informed that consuming more than 1 unit alcohol per day reduces IVF success. However, this recommendation was based on one study with 221 couples. A more recent review suggests more than 4 drinks per week reduces the chance of IVF, and this appears to hold good for men and women. The second aspect regarding alcohol is safety during pregnancy, as there is a health condition called fetal alcohol syndrome, which is linked to the mom's alcohol intake during pregnancy. And on this aspect, the national guidelines are quite clear. The safest approach is for women not to drink alcohol at all if pregnant or if planning for a pregnancy. Men are not completely in the clear either. There is ongoing research on a type of fetal alcohol syndrome which seems to be unrelated to the mom's alcohol intake, but instead seems to be related to excessive alcohol intake by the dad before pregnancy. The fifth lifestyle aspect we'll discuss is caffeine. The first point I have to make is that studies on caffeine intake have thus far been quite conflicting. The national guideline does say that women should be advised that taking caffeine affects IVF success rates, but that is based on one study with 221 couples. If the number 221 seems familiar, that is because it is the same group of men and women having IVF as the one referencing alcohol intake as well. And as far as I can see, the impact of caffeine and alcohol were not really adjusted as independent variables. Now, most studies do agree that 1 to 2 cups of coffee per day is unlikely to be harmful. The Royal College of Obstetricians and Gynecologists advises that women should limit caffeine intake to 200 milligrams per day during pregnancy, which works to around 2 cups of instant coffee. Personally, I would say this is a sensible middle road to take. A point to note is that tea and energy drinks also contain caffeine, so do be mindful of them. All women planning for a pregnancy should take 400 micrograms folic acid per day and 10 micrograms vitamin D per day. I do have to point out there is no clear evidence for any other vitamin supplement, and certainly even less evidence that fertility branded vitamins are any better than the box standard over-the-counter supplements you can purchase at your local supermarket. And this holds good for both men and women. I have a special interest on the topic. I was involved in a randomized controlled trial on vitamin supplements for men having ICSI for low sperm count. This paper has just passed peer review and due to be published shortly. Essentially, we found no major difference in the chance of having a pregnancy between the two groups. Some women do need high dose folic acid, and this is for women who take anti-epileptic medication, have diabetes, sickle cell, anemia or thalassemia, or have a BMI of more than 30 kilograms per meter square. This also includes women who have a personal or family history of neural tube defect or whose partner has a personal or family history of neural tube defect. And specifically, women who have sickle cell thalassemia or thalassemia trait should really take 5 milligram folic acid, not just for the first 3 months, but throughout pregnancy. Next, we come to stress and what stress reduction methods you can undertake. Now, IVF, without a doubt, is a stressful process. There have been many interventions described to deal with stress. This range from cognitive behavioral therapy, mind-body interventions, acupuncture, meditation. There's no evidence that any one method is better than the others. The silver lining is that pre-existing stress, in other words, stress before starting IVF, does not appear to negatively affect your IVF chances. Now, coming on logically from stress reduction is the impact of sleep. Now, sleep affects stress and stress affects sleep. There are several methods which have been described to optimize your sleep. And these are to sleep at regular times with a similar routine, making sure you wind down. This includes avoiding screen time, whether it be from mobile phones or TV, at least 1 hour prior to sleep, and also making your bedroom more sleep friendly. Mainly, don't take your work to bed. Getting 8 hours of sleep is associated with improved IVF outcomes. Of course, it's difficult to take out all the factors which may confound this association. A healthier lifestyle obviously encourages a better sleep pattern, and healthy lifestyle also improves IVF outcomes. But as I had said previously, the goal of this discussion is give you the tools on what you can do in your lifestyle to improve your chances. There are quite a few studies that better melatonin levels, that is a hormone associated with sleep regulation, is associated with better IVF outcomes. But thus far, the data seems to suggest that this is associative, that this may not be the melatonin itself, but rather sleep itself. So as things stand, the only proven indication for melatonin supplementation is jet lag. There's not enough evidence for safety profile for routine use. Particularly, one study has raised concerns as to whether taking melatonin may affect glucose tolerance, for instance. And therefore, melatonin use right now should be really used in the context of research, especially since the available data is not sufficient to say whether taking it makes a difference to live birth rates. The final two aspects I'm going to touch upon is not something that is purely under your control, but they are aspects you need to be aware of. One is your environment at work. Obvious risk factors are radiation and toxic chemicals. And I am sure if you're working in any of these environments, you would have had a risk assessment performed. Some risk factors are unclear. Evening or night shifts, for example, have been associated with a reduced ovarian response during IVF, but it is difficult to tease out the factors. People working night shifts are more likely to be in the bottom of the work hierarchy, and we do know that socioeconomic status affects your ability to maintain a healthy lifestyle. Recent studies have shown that socioeconomic status rather unfairly affects IVF chances as well. Also, shift time working has been linked to other lifestyle factors like obesity, hypertension, that's high blood pressure, and stress levels. Finally, we come to the wider environment, namely pollution. In particular, air pollution has been a recent subject of interest in the field of reproductive medicine research. High levels of air pollution do seem to affect IVF chances. Obviously, there are limitations to what we can do as individuals to limit air pollution, climate change, degradation in biodiversity. There are some choices we can make, such as the mode of transport. Cycling, for example, carries less risk of exposure to car fumes. Also, collectively, we could support initiatives to improve our wider environment, which no doubt will improve our own individual health, as well as the health of our human neighbors and the health of all other life on the planet. And with that note of optimism, I would like to summarize what we have discussed today in the past few minutes. Diet. No diet is better than the other. Just aim for a BMI less than 30. Exercise is beneficial. There's no need to stop exercising. Quitting smoking is highly recommended. Alcohol moderation is advisable, and so is the case for caffeine. Women need to take folic acid and vitamin D supplements. Stress seems to be associative rather than causing IVF problems by itself. Good sleep hygiene is advisable, and you need to be mindful of any risks in your occupation. And air pollution, there is not enough data, but probably wise to limit exposure. And with that note, I would like to thank you for your patient listening, and I would be happy to answer your questions to the best of my ability.